Hi, Jon Orrell. Welcome to 10 by 6.
Thanks for the invitation.
Oh, lovely to see you. For viewers that aren't aware, Jon Orrell is a Weymouth GP and also a Dorset councillor for the Green Party. And given that it's the 73rd birthday of the NHS in the next week, with lots of people demonstrating to save our NHS over this weekend, we thought it would be a great time to ask Jon to come on and talk about the NHS, what's happened in the recent past with the NHS, and his views on how things are now and for the future. So with that in mind, Jon, people say that the NHS is sort of facing an unprecedented level of threat through privatisation and other things. Can you give us your views on how that manifests itself, how you see that threat? What form does that take?
Well, it's a very real threat. The NHS has been like the jewel in the crown of the post-war settlement. Our forefathers fought right-wing fascists on the continent and won, and they did it on the basis of this. This is what inspired them, the Beveridge Report, which set forth a lovely vision of a England, a Britain free from want, squalor, ignorance, idleness and disease. And that's what they did. They were bankrupt, but they did it. They got houses, they got free education, and they got the NHS. And gradually, since Thatcher, the rise of personal greed, we've seen them whittled away. We've lost our council housing. We're having to pay for our university education. They've privatised all the utilities, but the NHS is loved by the people, so they can't get rid of it in one go. We've seen that in cabinet papers released from the 70s. They realised it was too difficult, so what they do is they whittle away at it. Their face will say, "It's safe with us." Every election campaign, you'll see the smooth words, but don't watch the lips. You watch the hands. You see what they're doing. And what they do is relentlessly chip away. Just little bits go here and there. Blood contracts, pathology services, everything is. So it's done on the sly. But if you corner them, they'll deny it. But watch what they do.
Yeah, it's described as death by 1,000 cuts, isn't it? And talking of which, I mean, that leads me on to ask about cuts. I mean, what I think we've seen is probably what could be described as a deliberate underfunding and cuts made to the NHS over the last 11 years of Conservative government. We've seen, considerable reductions in the number of doctors, nurses, hospital beds, other services. What do you think is the result of those cuts? How has that affected, patients?
Well, it's affected us badly. I've been working in the NHS now for 35 years. And I've seen what happens when the Conservatives get in power and cut the funding. So my early years were under Thatcher and Major, and the funding was cut. And I saw waiting lists rise to 2 years. And then New Labour, for all its faults, which there are several, but one of the things they got right was the funding of the NHS. And we got us back up to almost European levels. And the waiting lists came down to 2 weeks. By the time they left power. Now, 12 of Conservative rule, we see the waiting list rise and rise, and we can't blame it on coronavirus. This was happening long before, and it's again, they'll put their hands on their heart and say we're increasing funding. They don't. They're putting in. The NHS needs about 4% a year, and the reason it needs that is because of medical advances. It's not like we're running a bookshop here where the prices are fixed. We get new immunotherapy, great new cancer treatments, like the vaccine for coronavirus. It all costs money. So the medical inflation is 4 to 5%. And if they put in 1 to 2%, in effect, we have a cut. So what we see over the last 10 years is waiting lists rise and rise, getting up to a year now for some of my patients. We see that the numbers of doctors and nurses and beds, scanners, any kind of metric you like to look at, you compare us with our European neighbours, and it's dire. We're about 1/3 the number of doctors and nurses that we should have. We've depended for the years on being bailed out by people coming from overseas. Fantastic doctors and nurses have been prepared to come and help our NHS. And suddenly in the last few years, we've slammed the door in their faces. So we're really up against it now. The NHS is being underfunded, understaffed. And you've got to wonder why. Maybe they don't really want the NHS to succeed. And there's some wise words from Noam Chomsky, American, who described what happens here, that you take a public service, you underfund it, people get angry, and then you hand it over to private capital.
Yeah, thanks for that, and hopefully our viewers be educated by that, be well informed by that, but it can also, hopefully what you've said there resonates with their personal experience and that of their families, what's been happening. Certainly I know people that have been waiting a long time for consultations or operations. Which leads us on a bit to the issue of privatisation, as well as underfunding and cuts. There's been a shift towards privatisation, much as the Conservatives deny that and will continue to deny that. And I believe a lot of that was really the doors were open to massive wide-scale privatisation from the Health and Social Care Act of 2012.
Yeah.
And I mean, even recently, we read that the Oprah Rose, owned by Centene, a huge American health insurance corporation, have taken over 37 GP practices over 49 sites in London, meaning that Centene now owns roughly 70 GP surgeries across the country, making them the biggest GP network in the UK. They're a health insurance corporation from America, pretty staggering. So what's your view? That's just one example. I'm sure you could give a huge number of others. You mentioned, NHS blood services that were sold off years ago. What do you see as the dangers? Is your experience that privatisation is now pretty wide scale and is going to get worse? And if so, what are the dangers of that, John?
Well, the dangers are plain to see. We've got Moore did a great film, which is probably available widely now, but comparing the American healthcare system with the European, and particularly the NHS. So the plain danger is, when we can see it in America, we don't have to, this isn't something we've made up, it's plain fact. The American healthcare system costs 3 times as much as the NHS, costs a fortune, more than Germany and France, and yet it delivers worse outcomes. And the reason it does is because there's a 40% chunk taken out as pure profit by these American corporations. That's not money that's going for operations, not paying for cataracts, not paying for hips or nurses' salaries. It's purely shareholder profit. And that's the way we're heading if we copy the American model. And the way they make those fat profits, and we've seen it, and we're starting to see it now, is they squeeze at both ends of provision. So they'll start knocking out high-cost procedures. Some of the new breakthrough cancer drugs, you'll find you can't get them. And they'll squeeze at the bottom end. And they'll say you can't have your varicose veins done or your hernia, you just got to carry on in pain. And they just squeeze at both ends and make it harder and harder. So poor old Americans, if they get ill, if they're lucky enough to be employed, they're okay. If someone in America gets cancer, loses their job, that's it. Bankruptcy, you lose your house. And do we want to go that way? I don't think so. But that is staring us in the face. These American firms, they're absolute sharks, and they're being attracted by the blood that's been spilled in the water by some of our politicians. It's, again, as I was saying before, it's a relentless thing. Sadly to say, Milburn and Hewitt were doing something like this 15 years ago. Lately, we've had Lansley, Hunt, and Hancock doing the same. They just keep, they'll swear blind they're not doing it, but they keep giving more contracts to Oprah Rose or Optum. And now Javid's in charge, and he's come from a merchant bank where he was paid £1,500 an hour to advise private healthcare companies how to make money. So we have a wolf in charge, and we need to be on our guard.
Absolutely, yeah. Yeah, that's very worrying, and I mean, probably most of our viewers are aware to some extent of how awful the American healthcare system is, and for us to be moving rapidly down that road is pretty appalling, pretty scary,
Yeah.
really worrying. You know, maybe especially if you have elderly relatives, or if you have families, if you have children, you know, whoever you are, this is such a serious matter and such a concern. As you say, the American models, you know, around 2.5 to 3 times more expensive per person, delivers terrible results. Tens of millions of people can't afford to have any access to healthcare whatsoever, to have health insurance. And for those that do have health insurance, the average cost now is £4,000, $5,000 per year. That's the average cost. On top of it, and that doesn't pay for everything. On top of which there are co-pays, there are deductibles, meaning, you know, a bit like we have insurance excesses, meaning that you have to pay for things, and certain illnesses people find are not covered. Once they fall ill with them, their insurance company says, oh no, we don't cover you for that. And as you say, bankruptcy through medical debt is through, you know, debts accrued from medical bills is the #1 cause of bankruptcy in America. What an appalling system, and the idea that we're heading that way ourselves is ludicrous and very, very worrying. So yeah, so you mentioned there, you mentioned about, you know, increases to waiting lists earlier on, and you know, people locally, they're concerned about access to their GP. They're concerned about, you know, getting to see a consultant, which seems to, the waiting list for that is longer and longer now. If they can get to see one, they're concerned about waiting list for operations, for, you know, for all sorts of things, whether it's cancer treatment, whether it's, you know, hip replacements, etc., etc. And an increasing number of treatments that are unavailable. I mean, you say about these American companies, they're you know, they're concerned for their shareholders and their profits, and Centene in their 2018 annual report said they're withdrawing some services because they don't meet their profitability targets. That was all they were concerned with, not patient care, not the health of those they serve, but profitability targets. That's their #1 concern. And so they were withdrawing from certain contracts and things being available. So people are worried they'll get ill in the future and be told, yeah, the NHS doesn't cover that anymore. So how and why do you think those things are happening, John? And in your experience as a local GP, how has that change manifested itself for your patients over the last 10 years?
Well, yeah, picking up the examples you gave, yes, it's harder to get what's now classed as minor surgery is getting restricted. The high-cost cancer drugs are being restricted. So that's from the top and the bottom. And then from the sides, we're losing whole chunks entirely. So if you look at NHS dentistry or optician service, again, all used to be included. Now, when you go to the dentist, you go with your credit card, and it doesn't have to be that way. But from every direction, the NHS is under attack, and that's how it shows itself. So yeah, it's a real problem, and we can do something about it as citizens. It's not a done deal. The NHS, what I was saying at the beginning, it didn't start by accident. It started because people were absolutely committed to it. They got the vision. They become active, engaged citizens, and they fought for it. They fought a war for it, and they won the peace. Our forefathers did it. We can't just relax. We have to do the same. I heard Tony Benn say years ago, every kind of generation has to refight the same battles. And here we are. It's our battle now. This is baton has been handed to us. We have to carry it on for our children and grandchildren. And the way we do it is by being engaged citizens. Find out about it, read about it, go on the comment columns on social media, stand up for the NHS, write letters, write to the MP when they're making the cuts, when they say they're going to cut hospitals. Write about it. They have to come back to elections, and so finally, when we come to elections, vote for candidates that support the NHS.
Absolutely. Well, that's a great place to end, and really pleased that you've indicated there how that it's up to all of us. It's up to all of us to carry that torch for future generations and to do our utmost to save our NHS before it's gone. So thank you. Thanks for that stirring message, John, and thanks for the work you do and have done for so many years in Weymouth, and for standing up for our NHS and for the health of our local people. So thank you so much for spending that time talking with us today.
Yeah, thanks for the invitation. And I'll end with the words of Bevan, the founder. The NHS will last as long as there are folk left with the faith to fight for it.